I start this session with two alarming facts and figures which are copied for reinforcement, since it's a session on healthcare and hence the thought. Number one is that the next future of Indian and global healthcare stands actually on mental well-being. That I myself have been associated with the largest of hospital chains and healthcare conglomerates worldwide. We have been seeing it extremely deep. Now, mental well-being is something that most of you either take it not so seriously or don't understand the depth and details of it. For example, 2 minutes of intense anger can actually cause a negative retardation of your cortisols that can actually reduce your life by more than 24 hours. These are published scientific data that I'm speaking. Number two, around 10 years ago, we had one patient on a scale of 400 people who was either diabetic or pre-diabetic. As I speak today, for many of you, it may not be so serious and you may be casual, but when only diabetes knocks you, you'll understand. It is one patient out of every 3 people across India who are either diabetic or pre-diabetic, within bracket undiagnosed. When it's undiagnosed, it means that they have not done their tests and hence they don't know that they have diabetic symptoms. This is an extreme sense of alert, and if we don't curb this, then India, the direction that it would go is extremely devastating. Friends, colleagues, ladies and gentlemen, with this, I start the discussion. Where are we really heading in Indian healthcare? In India, it is a grave situation in totality from the healthcare perspective. Many of you take it so relentlessly casual, and I want it to record, because for you, you can afford medicines, you can afford insurance, you can afford hospitals. But more than 83% of Indians, they cannot afford expensive branded medicines. They cannot afford, even if they can afford, they cannot get the health insurances, and they cannot get a decent bed in a decent hospital when they need. For you, when you are sick and when you will be close to your deathbed, you still may get those hospital beds. But there would be people who may not get those hospital beds and who don't get. In fact, when we work in the rural villages in India, we find that these people even cannot afford a leather chappals. Forget about expensive branded medicines. And what are we doing? Practically nothing much. We are only relenting and working towards just shouting out that the government would be doing it. Yes, the government is doing a lot, but it's a shame when corporates, individuals, so-called professionals, they just work towards earning their own money and ensuring that their families are well. It's not only a shame, it's a literal sense of deep shame that the country is undergoing. And that is where we are working relentlessly to ensure that India becomes much more healthy by offering very high quality generic medicines. We have medicines of almost all the therapeutic segments, right from peds, gastro, nephro, obs, gynae, cardiac, diabetes, so on and so forth. And the efficacy and effectiveness are of a very superior nature. But these medicines are less than 70% of costs than the branded medicines. That is what India needs. India does not need big jargons. India actually does not need big AI tools and blog datas and apparels and stuff like that. India needs to be more healthy, and India needs to have the right kind of education system. When I find and see youngsters not understanding the purview of the depth, then it is a very, very saddening fact that they are just there to pass on their lives. But these people in the villages, since many of you don't work in the villages and I do, I see what they undergo on a daily basis. A mother who cannot afford medicines of expensive drugs, a family that cannot afford, they break the pills and take the morning, afternoon, evening pills are taken twice rather than thrice, assuming that they will save cost. But they don't understand that the efficacy will not really happen in that way. If we don't change that color of India, then you may be retired, you may have a good amount of money in your bank, but India will still continue to become poor and poorer. And that is where we are working. That is where we are working relentlessly across the country to ensure that we offer very high quality medicines and a reasonably high quality healthcare with extreme affordable costs. Why I'm saying this? I know that for some of you it may not be so interesting as a topic, obviously, because you have money where you can feed your stomach. But go once at least to see those mothers who don't have medicines to feed their children. And that is the future of Indian healthcare. The future of Indian healthcare is not robotic surgeries only. The future of healthcare is not how immaculately we incorporate the stents of the angioplasties and angiographies. The future of healthcare is not only about the TKRs and the THRs that's been done for the knee replacements and hip replacements. The future of healthcare is first to ensure that we give the basic healthcare to everyone who needs health at large. And that is where we are working. At least if I can change one person in this room, I would do justice to this 15-20 minutes that I'll be speaking. And every forum that I speak across the country, every panchayats that we speak, every municipalities that we speak, every women forum that we speak, we try to make them understand that if we are not cognizant of the fact, then India is not growing. And that is the future of healthcare. For us, innovation stands extremely strong. And when I say innovation, for example, many of you who are vegetarians out here, they may have a gap of methylcobalamin in the body, which is commonly named as vitamin B12. For a common person, if the deficiency of vitamin B12 happens, usually they have to go to a clinic or a hospital and take an injection shot, anything close to 350 to 400 rupees. From where do they give 350 to 400 rupees? For you, you feel that it's not much, but trust me, it's a huge amount of money. And there is where innovation comes in place. If you come to any of our network, you'll get the same methylcobalamin 1500 mcg at only 12 rupees, and that also without our injection shot. It's just a strip. And it goes on and on and on. It is not how jazzy you stay. It is not the kind of organization and the brand value that you build. It is whether you are really passionate to build India at a large. And that is what drives all of us. That is what kicks us in the morning to say that we can improve one more village in the country. We can give that amount of respect to one more woman. We do a lot of work for women across the country on menstrual hygiene, because we know that menstrual hygiene is a critical parameter where women suffer a lot. They can't afford sanitary napkins. They use normal cloth that becomes wet, and then they get UTIs. To our people who don't understand what is UTI, it is called urinary tract infections. And intensity of UTI, when it increases, there are multiple symptoms, including fever, irritation, so on and so forth. Those are the things that India needs for healthcare. It's really, really sad that in a forum like this, we don't discuss these things much. We discuss very big things. We discuss big brands. We discuss about artificial intelligence. We discuss about blockchains. What are those things when someone don't really have food? When someone don't even know that if they're having a headache, they can't afford medicines. I don't understand the rationale of such kind of events when people are not really understanding that, where India is and where India should be taken forward to go. It is not your perspective. It is only because unless you really stay hungry for good 2 to 3 days, you'll not understand the importance of food. Unless God forbid, you get into that day that you can't afford medicines, then you will understand what pain you can actually undergo. A typical household that have either a cardio or a diabetic patient or any of the geriatric patients, and they have to easily spend a bill value of close to around 5.5 to 7,000 rupees branded medicines. There is, where we come into action, where we slice it down to good 1,500 to 1,600, a good 70% savings. Where will people have so much amount of money? It's not about how much ticket value you can increase. A good retailer is about how much ticket value you can decrease. There is where the class of a good corporate enterprise comes into. A good retailer is not how much you're pushing the items to the end consumer. A good retailer is someone how much you are pushing the value to the end consumer, genuine value, and trying to save more money. That is India. Once retailers in this kind of forum understand it is not to build your ticket value, then you understand that you do justice for yourself and for country at large. That's the future of Indian healthcare. Jai Hind.